We are back here on Girl Talk, and Dr. Peter Liggett joins us now. He is new to the area, and he's a retina and macula specialist. It is great to have you here.
Thank you.
Tell us about what you do and how you can help people. Let's first talk about, I guess, macular degeneration. Is that your primary focus?
Well, macular degeneration is one of our primary focuses. As people may know, age-related macular degeneration is the main reason for visual loss in patients over the age of 60 in the United States. More people have age-related macular degeneration than all of the patients who have cancer.
Wow.
2% of people at age 50 have macular degeneration, but over the age of 80, 30% of people have macular degeneration.
My grandfather had it. He described it like black, sort of a darkness, little dark spots. Is that right?
Exactly. You lose your ability first to be able to read, and then you can't see faces. You retain the peripheral vision, though, and you never go stone blind, but you can't read, you can't drive. You can't recognize a face, say, in 5 or 6 feet.
Wow. So is it one of those things that getting early detection, making sure you're staying up, or are there specific tests that you do to check for it, and then you can monitor and make sure that if something does go awry that you can then address it quickly?
Exactly. Prevention is part of the cure. It is impossible to tell if you have this yourself. You really need your eye care professional to look at the back of your eye to see if you have early changes or more advanced changes, because this is a painless disease. There's no redness. There may be symptoms. There may not be symptoms.
Oh, so it's tricky.
It's very tricky.
So there's nothing really set where people will have a certain sensation or feel something and then say, oh, this must be macular degeneration.
Exactly.
So it's kind of silent then.
It's a silent disease early on, and that's why if we see it early, then you can make certain lifestyle changes. If we see it early and it's the wet form, which is the most blinding form, then we have very good drugs that we can intervene with.
What are the lifestyle changes?
Lifestyle changes, for example, would be to eat green leafy vegetables and fruit. I know that's terribly boring and everybody says it. Exercise 3 times a week will cut your risk of developing macular degeneration by 25%.
No kidding. That's significant.
Absolutely. Lowering your cholesterol if it's elevated will more than double improve your chances of continuing to see well, along with decreasing your diastolic blood pressure below 95. So there are many lifestyle changes that you can make that impact how severely macular degeneration may affect you.
You've got some props here.
I've got some props. I brought some gumballs to show you the size of the human eye, which is about 1 inch, and it weighs about 2 ounces. And people often wonder, well, what is the biggest eye in the animal kingdom? And if I could have the prop, please.
Of course.
Here's a volleyball. And this would be the size of the largest eye in the animal kingdom from a giant squid.
What?
So,
Oh my gosh.
I don't know if you'd like walking around with that. It might be hard to treat, actually, from our point
I
of
thought you
view.
were going to say, like, I don't know, an elephant.
That's where I was going.
Too. What a giant
I didn't want to.
Wow.
Some other facts about the eye. Did you know that people with blue eyes all originated from a single ancestor about 10,000 years ago from the North Black Sea area in Ukraine? Did you also know that people with blue eyes can tolerate alcohol better than other people?
Really?
Yes. I know that's an important fact.
Especially in this area.
People often ask me, what is a prototypical person like who might get macular degeneration? Who are those people that are higher risk? And I say Hillary Clinton. And this is not a political promotion. But Hillary has blue eyes, she has fair skin, she's a bit overweight, she probably eats a high-fat diet, she's probably farsighted, and she probably has some hypertension. And all of those things are high-risk features for developing macular degeneration. The very worst thing you can do about macular degeneration is smoke. 30% of all macular degeneration is thought to occur from smoking.
Wow.
So interesting.
That's amazing. And then this we're just showing a little bit of a
This shows you the
detail of
eye.
the eye itself.
The-
And just quickly, we've only got about a few seconds left here.
The eye is like a camera, the light coming through the pupil and focused on that tiny area called the macula, which is the area of our finest vision. To read, write, drive a car is in that tiny area. And the macula is the size of the head of an eraser. And the very center is the size of the head of a pencil, which is the 20/20 vision area. So this is a teeny, teeny area.
And just know that there is a specialist here that can help and offer some treatment options and get them on the right path.
We are here all the time. We don't live in Savannah. We don't live in Charleston. We're here every day for you. Christmas Day, New Year's, Hanukkah, Halloween. We're here all the time. We live in the community. We're here to serve the community.
Help you all
Get
to
your eyes
see
checked.
better. Absolutely, no question. Stay tuned. Thank you, Dr. Liggett. Thank you very much. Stay tuned. More to come here on Girl Talk.